Hello, everyone. My name is Pamela Staples, and I am the Public Health Program Manager for the Good Health and Wellness in Indian Country project. On behalf of the GHWIC 1903 team, we would like to welcome each of you to this very interactive Year 3, second quarter interactive training presentation entitled Building Psychological Resiliency for the Public Health Workforce During the COVID-19 Pandemic. We are very excited and we were to have this presentation today. It is going to be a spirited discussion and we look forward to all of the information that we will learn today. I always like to leave us with a positive affirmation as we're beginning. And I'm going to leave us with one today. No matter what comes your way, stay positive and stay grateful. Never lose hope and never stop fighting for what you believe in. That's our positive affirmation for today. I'll turn it over to Keisha for introductions.
Thank you, Pamela, and good afternoon, everyone. It's exciting to see everyone today. Just wanted to be cognitive of time today. I'm just going to have the GHWIC team introduce themselves, and then I'm going to have everyone else introduce themselves in the chat and just include your name, your position title, and then your tribal nation. So I'll start off. My name is Keisha McElroy, and I am the Public Health Program Coordinator with USET.
Hi, everyone. I'm Jasmine Alvarado. I'm the Senior Project Administrator at USET.
Good morning, everyone. I'm Alexis Goddard. I'm the Admin Assistant for the GHWIC team.
Good afternoon, everyone. I'm Caitlin Jackson. I'm the Evaluation Specialist for the GHWIC team.
And as I previously discussed, I'm Pamela Staples, the USET Public Health Program Manager for the GHWIC team.
All right, thank you, team, for the introductions. Actually, I noticed that I'm on here several times, so if you all, go ahead and include your intro in the chat, and then I'll turn it over to Jasmine for housekeeping.
Hi, everyone. Again, just to let you know, the presentation is going to be recorded, as you know. It will be available at our USET YouTube website within about 5 to 7 days. Also for our GHWIC partners, it's going to be available on our SharePoint site. Towards the end of the presentation, you'll have an evaluation link in the chat box. And you'll also have an opportunity afterwards to take about 4 minutes to do that evaluation. We would appreciate it. I think that's about it. Thank you again for joining us. I'm going to turn it over to Alexis.
I'm going to read off the agenda for you guys. We're going to have Kaylin introduce the presenters, followed by the hour-long presentation on building psychological resilience for the public health workforce during the COVID-19 pandemic. We will then have questions and answers, and lastly, we will wrap up with closing remarks.
Thank you, Alexis. So our first speaker today will be Laura Lloyd. And Laura is the Associate Director of the Region 4 Public Health Training Center and oversees all professional training programs for the public health workforce in the 8 southeastern states in HHS Region 4, including in-person skill-based trainings, online live and on-demand webinars, the Regional Public Health Leadership Institute, self-paced modules, and field placements. Laura Lloyd has over 30 years management experience in continuing professional education, program planning, applied practice experience advisement, workforce development and training, and health education in the university, nonprofit organization, and membership association settings. So now Laura will take it away.
Thank you, Kaylin. Can y'all see my screen? Just a thumbs up, great. Thank you very much. Thanks so much for giving me a few minutes on your schedule today. I'm just going to tell you a little bit about our center, and then I'm going to turn the rest of the program over back to Kaylin and Mark. As Kaylin mentioned, I am the Associate Director of the Region 4 Public Health Training Center, and it's our pleasure to bring you today's session called Building Psychological Resilience for the Public Health Workforce During the COVID Pandemic. It's presented by Mark Evces, and Mark presented a similar session for us to a broader audience toward the start of the pandemic. And with never ceasing ongoing pressures of the workforce, the need to build resilience continues. So I hope that you get as much value out of this session as folks did back in the past. Before I do turn it back to Kaylin, I did just want to tell you a little bit more about the training center and some of the offerings that we have. Let's see. We are a member of a consortium of 10 HRSA-funded regional public health training centers, and together we're the country's most comprehensive resource for public health workforce development. Each of the 10 regional training centers serves a different HHS region in the country, but collectively we help public health professionals build the core skills and strategic competencies necessary to address current and future public health challenges. The Region 4 Public Health Training Center serves the 8 states in the Southeast, and our central office is located at the Rollins School of Public Health at Emory University in Atlanta. But we work with 7 community-based training partners and 3 technical assistance providers to serve the entire region. I know some of you are from outside Region 4. I saw some of that in the chat box, and so I've included a link here, and I'm going to drop it in the chat box in a minute, to a page that provides contact information for the other regional public health training centers around the country. Although we have slightly different offerings, we are all committed to helping develop public health professionals. So I'll drop that in the chat box at the very end of my short intro. In line with our national goal, the Region 4 Public Health Training Center helps build and sustain a skilled workforce with free learning tools and support designed to meet the unique needs of professionals in state, local, and tribal public health departments within these 8 states. We offer professional development for the current workforce, funded experiential learning for students where public health students are placed in local, state, or tribal health departments or health organizations, and consulting and technical assistance to health departments. I wanted to highlight just a few of our training offerings. These are all free, and with the exception of the Public Health Leadership Institute, they're all open to participants from anywhere in the country. The first is our Public Health Practice Academies. These are skill-based 2 to 3 hour online workshops, and we offer a variety of topics. You can see them here, but from conflict management and data analysis to seeking health equity, strength-based leadership, holistic leadership. These are all free, again, and generally open to all. However, if you are in Region 4 and you would like to host one of these exclusively for your tribal health organization or health department or health organization, let me know, because we have done that before. A health department might reach out to us and we'll host one exclusively for their population. The other highlight I wanted to share was this Public Health Leadership Institute. This is an 8-month course for emerging public health leaders from state, local, and tribal health departments or tribal health organizations. And it's designed to advance adaptive and strategic leadership skills to support multi-sector vision setting and leadership necessary to address those social, community-based, and economic determinants of health. Topics include adaptive leadership, leadership principles, cultural competence, managing conflict, etc. As I mentioned in December, when we hosted a similar webinar in December, we're currently in our 3rd cohort of these institutes. And altogether in our first 3 cohorts, we've had 4 fellows from USET and 5 from tribal nations in Region 4. I was just telling the others, we've just applied for a new cycle of funding for our training center. And if we're successful, we will start recruiting participants for the next cohort this summer. So please consider applying or nominating somebody from your tribal nation if you're in Region 4. This is the one offering that's really exclusive to participants from our region. But if you're from another area, the other regional training centers may have similar leadership trainings available. And the last highlight is our 90-minute webinars. These address these priority and emerging health issues in our region. And we've offered webinars on lots of different pressing issues, including childhood obesity, mental health, opioid misuse and abuse, HIV, AIDS, and of course, COVID. Nearly all of these webinars are recorded and available for free on our website. Just to highlight a few trainings that are new or coming up, we have a new Adaptive Leadership for Public Health podcast series, and these align with those topics of the Leadership Institute. The first 4 episodes are available. They're free, of course. The next 2 episodes, Collaborative Leadership and Leading Change, are coming up within the next 2 to 6 weeks. I will drop the link to the podcast in the chat box when I finish up. And then upcoming webinars, we have something next week called Professional Growth Through Public Speaking. Unfortunately, that one is filled to capacity, but we are recording it and we'll have information on how to watch the on-demand webinar within the next several weeks. And then we have a session called Diversity, Equity, and Inclusion in Public Health, Why It Should Matter to Everyone on April 6th. It has limited capacity, but we're going to promote it and open it next week. So look for an e-blast from us if you're on our listserv. And then we have 3 3-hour skill-based virtual workshops coming up. One is on human resources on April 14th. The next is persuasive communication. This is presented by Shayna Merlin, who presented the webinar in December. And that's on April 20th, and then Rethinking Conflict on April 28th. And with that, I just want to encourage you, if you haven't done so already, to go to our website and check out all of our trainings and resources that we have available. You'll see many other on-demand webinars and self-paced modules. Thank you so much for letting me have a few minutes of your time to share what we have to offer. I'm going to drop my contact information into the chat box, but it's also on the agenda that I believe was sent out to you ahead of time. And with that, I'll stop sharing and turn the program back over to Kaylin. Thanks so much.
Thank you, Laura, for that information. So now I will introduce our presenter today, Mark Evces. I got it right. Mark Evces is an organizational consultant and clinical psychologist who has worked with scores of organizations and leaders to promote healthy, inclusive, and generative work environments. Prior to founding Workhaven, he served as the Associate Director of Mental Health in the NYU School of Medicine, WTC, Health Program Clinical Center of Excellence, and Clinical Instructor of Psychiatry at the NYU School of Medicine. He has worked across a variety of public, mental health, clinical training, and research settings. Dr. Evces, with Gertie Quatangon, MD, co-edited Vicarious Trauma and Disaster Mental Health, Understanding Risk and Promoting Resilience, published by Routledge Press in 2015. So now we will hear from Mark.
Thank you. I know we gave you some complicated last names.
Yeah, I should have asked for the pronunciation on
That's
those.
okay. You know, you got
I tried.
Croatia and the Philippines right back to back there. It's a challenge. It's a real pleasure to be here. I'm gonna go ahead and share my screen if that's okay. Let's see. I think I can do this. Yep. I'll go ahead and put this in presentation mode. Now need to make sure I can see the chats here. So I have to, may or may not be able to figure that out. Oh, no, there it is. There we go. Okay. So it's a very great pleasure and honor for me to be here. My name is Mark. Amongst these public healthcare providers, I see that some people are in management leadership positions. Some may be more client-centered, focused. Some people are in data. Some people are in leadership. Some people are in direct care. All of us focused on public health and community building. And that's why I feel like this is a good place for me to be today, because this is really my passion. I am a psychologist, clinical psychologist by trade, and went to school in Georgia and worked in rural areas in the South, and then in urban areas in Atlanta, and eventually in New York City. at Bellevue Hospital and NYU Medical Center, basically looking at the impact of adversity, oppression, and trauma on individuals and how we can help people thrive and become resilient in the face of stress and adversity and even trauma, how people can survive and even thrive. And in the course of that work, I became aware that there were systemic and organizational, even societal impacts on people that we weren't able really to address individually in therapy. We can't change some of the oppressive forces out there. So maybe we could get a group of people, psychologists, together to work systemically at the systemic level. And that's what I've been working on. We formed a group called Work Haven, as in work should be a haven for you, not a place where you encounter more oppression and adversity, but a place where you feel safe and effective to do your work. And so I want to thank the partners here today, USET and the GHWIC program. I'm not going to try to pronounce the acronyms. I don't think I'll do a good job. And of course, Region 4 Public Health Training Center for allowing me to be here today. Workhaven is a group of clinical psychologists dedicated to systemic change in a positive direction. And so in addition to Workhaven, I also co-edited a book with, and that was wonderful pronunciation, Dr. Jurdi Quatengon, who is a psychiatrist. And basically we wrote and got our colleagues to contribute to a book on what happens to people when they are on the front lines of healthcare, particularly mental health, and particularly during disasters. And a pandemic is an ongoing disaster that is quite complicated in its course. It can wax and wane, and you think it's gone, and it comes back, and all kinds of interesting things can happen. But it's certainly a long-term stress for all of us in public health. So first, I wanted to thank everybody for being on this call, for the people who organized the call. One of the central things that we look to become resilient, which I'm going to define shortly, is a sense of meaning in our work. We could be doing lots of different things today with our time. We could be doing potentially lots of different kinds of work, but you chose to be here. You chose to do this work. It is difficult work. And so I am constantly expressing gratitude to the people who do this kind of work, because there was a time when we did not have public health. I live in New York City. You can look out on a place called Roosevelt Island, which is a little tiny island, if you don't know, in the middle of the East River. And in it, you can see a sort of crumbling old building that they left there the way it is. And it used to be a place where people who had smallpox were left. You were sent to that island, and you had to stay on that island. And many of those people did not come off of that island because there really was no public mental health movement yet. But that's where it began, as most of you probably already know. And so I always look at that. I actually live across the river from it and think, you know, what amazing advances we've made, not just in technology and medicine, but the idea of public mental health and the idea of community health is just an amazing force and a human achievement. So thank you for contributing and being part of this amazing movement of public health. One of the things that I want to do is create a little bit of an experience today. I know you may be on audio, you may be on video. You know, it's difficult to be present when we are not present physically with each other, because we are hardwired to respond to each other in nonverbal ways, to pick up on cues from each other when we are physically present with each other. We don't have that. We have to rely on electronics and Wi-Fi and all this technology. So we are ironically connected, but disconnected. So I'm going to try to introduce some experiential, in other words, we're going to do things during this webinar, but I really want to encourage you to use the chat box, which, you know, people have feelings about, understandably, but just to answer some of these questions that I'll ask along the way. And if not, that's absolutely fine. But I just would love for you to meditate a little bit on, here's the first question. What led you to attend the webinar today? Is this something that a supervisor told you to do? and you're trying to be the good staff member? Is this you as a leader trying to model some behavior for other folks? Are you trying to learn something specifically? Are you in distress? Are you looking for inspiration? Is this your role? Allow yourself to just drift a little bit into this question. Would love to see it on the chat box, but it's not pass, fail. It's not success or failure. Just why today? Why spend time on this today? Because what I would love to happen is for you to allow yourself, I use that word very intentionally, to be present during this experience. I watched a few of the other webinars on YouTube, and they're really great. So I'm not surprised for someone to say they were inspired by others. I'll try not to be intimidated by the high quality of previous presentations. Openness to learning new things, to become more self-aware. I mean, look, these are incredible sort of internal drives people have to better themselves, to help their teams, providing support to teams. And we're going to talk about teams today. It's a lot of leadership, I can tell, on this webinar. Coming out of fight or flight. Wow. Okay. So some of you folks, maybe all you folks, are already pretty well educated on what's happening. I'm a fan of professional development too. It's one of the answers to burnout, is to be evolving, is to be learning. In fact, if you want to hire somebody, and we were talking about this earlier before the call, if you want to hire somebody, you really do have to offer opportunities for professional development to this generation of people entering the workforce. They want to grow. And if you're not, quote unquote, selling a growth environment, it's hard to get good people. So thank you. Keep those responses coming. So let's go down this path, hopefully this verdant green path here, and see if we can help do things like improve the work environment and practice what we preach here. Here are our objectives today. We can say this in different ways, but obviously we're being impacted, and I'll go through this briefly because I think you know what the stressors are, but I'd love for us to just start normalizing in our work environment and internally. Let's be aware of the stressors that come along, because this has been a slowly building and long lasting pandemic. And it's easy to get used to the stressors and to forget that we are all deeply emotionally vulnerable. We are emotionally vulnerable when we forget to eat breakfast, and we are emotionally vulnerable when we've been on a computer all day alone. And we are emotionally vulnerable when we've gotten back to the office and haven't seen anyone for 2 years. There are so many stressors that it's easy to forget that they are there and they're impacting us. And that's important, because once we're aware of what's impacting us, we can become aware of how we might respond to them effectively instead of reacting to them impulsively. And I'll talk more about that. Second goal is to talk about self-care. Self-care is used so much, it's almost lost its meaning. But the idea is that we develop a way of life informed by psychological science, informed by our own spirituality, informed by our own cultural and community traditions, to be able to persevere through stress, adversity, and trauma, and to even learn and grow from it. And that's what we call thriving. So from awareness, we become stronger. And as many people have said before, we can become stronger at the broken places. In other words, we grow from adversity. That's not to say we aren't harmed by it. That's not to say that we don't suffer at times. But what are some ways that we can strengthen ourselves? Or I would say more accurately, get in touch with the strength we already possess as individuals, teams, communities, even societies. And then list 2 people professionally or personally you can connect with to have an ongoing dialogue about your efforts to build psychological resilience. So from awareness to strength to connection. And I know a lot of people on this call, we were talking about the leadership team before this call about how connected people feel. We are social animals. We are built to connect with each other. We have literal physiological elements inside of us, like oxytocin, systems of hormones and reactivity that are responsive to human connection. We need human connection. We know that without it, children don't grow into healthy people, and healthy people become unhealthy people. One of the great challenges of the pandemic has been isolation. And hopefully we're re-emerging from that, and that in and of itself is a stressor. So we'll talk more about that. So those are our objectives today. If you have any questions, comments, please let me know. I'm happy to address anything along the way. So let's talk about awareness. First, so a few definitions. Resilience, what does that mean? If you break it down into its Greek roots, it means to bounce back. If we're talking about physical medicine, it means our ability to fight off illness and recover from injury. Well, if we're talking about psychology, we're talking about a process in which we live. We live in such a way that when we are bombarded by stress and adversity and trauma, we have the best chance to maintain our functioning and pursue meaning in our life. If we become overwhelmed, that's fine, that happens to us, but we want to be able to bounce back from overwhelm. And that is not a trait that you have, like one person's resilient and the other isn't. It's a way of life. So resilience is a process. Are you living in a resilient way? It's lifelong. The goal of resilience is to be able to thrive as much as possible. And thrive in the psychological sense means to be at our best. You cannot always be at your best. If you think that you can, it's really not a very healthy attitude, because you're going to feel like you're failing a lot. We need to allow ourselves to thrive as much as possible, but not all the time. And when you're thriving, you're highly functional and you're not feeling a lot of distress. It's aspirational. So what we want to do is maintain resilience to give ourselves the best chance of thriving as much as possible. We've all had those days where we're thriving, and we're just the day goes by, we got a lot accomplished, we're feeling connected, we're an effective leader, the team's doing well. And then there are times where we're just struggling to stay resilient, to stay functional. We need to be healthy, and getting through the day is successful so that we can get to a new one. So I want to distinguish those two concepts and really describe them both as processes or ways of life. Everybody's under a lot of stress. This is an American Psychological Association stress survey. They do it every year. It's nothing you haven't heard before, but here's some data. We're all under a tremendous amount of stress for a variety of reasons, including the coronavirus. And that's evolving, but hopefully in a positive way, but certainly we are all stressed. Healthcare industry, 96% burnout amongst physicians. This is about a year old, this data, 2 years old. And leaders don't always realize how much their staff are burned out, but it's a serious problem. And by burnout, I mean people who are emotionally exhausted, they don't feel effective at their job, and they've lost their sense of meaning. They become cynical. Like, my work isn't impacting people. I don't believe in it as much. It is a normal response to feeling overwhelmed. And so what we're pointing out here is a lot of people are under a lot of stress. A lot of people are struggling with that stress. Physician burnout, but this can be extrapolated, I think, to all public health. There is data, I don't have it on the slide, I apologize, but increased risk of mistakes in the workplace, including healthcare incidents, poor quality of care due to low professionalism, we're just not as good at our job, patients and clients aren't as satisfied with us when we're burned out, And this is a very New York centric comic, basically saying the helpers need help. In this case, it's your typical Upper West Side analyst, which is, I realize, is a very specific image, but we're all on the couch too. The public healthcare providers also need to be taken care of and need to be healthy themselves. So the second question for you to think about, and you could just put a word maybe in the chat box or more. How has COVID-19 affected you? I thought the ocean would be a good backdrop here because it's potentially endless. Everything from deep personal loss of friends, partners, family members in ways that are unprecedented. For example, people you are not able to physically say goodbye to. We all know these experiences, either ourselves or through others. So if we could just take a moment to bring into our minds the ways that COVID-19 has affected you personally and certainly professionally. I'll tell you, while you maybe allow yourself to be in that space, that I've taken part in a lot of support experiences for public health care, and even an ongoing group. For about a year, I met with some public health care leaders. And while they dealt with folks who didn't agree with the way they were doing their jobs, didn't believe in certain public health care interventions, even dealt with hostility even amongst the public, they had their own personal losses and loss of employment, for example. Many people, loss of connection, such a tremendous loss of connection. Reevaluation of everything you could imagine. So much that we have reevaluated and is being reevaluated now, and concretely manifested by the Great Resignation. How many people have voluntarily left their jobs as a result? So there's a whole ocean of how we've been affected. We've shown some data. It's real. Hopefully things are changing in a positive direction. We know these things can change. So let's start with the meaning making piece. As Jason says, look at all those different ways that people can be impacted. And some of this, and I'm glad you guys are putting this on the screen. There's a lot that we don't talk about that happened in hospitals, sort of out of sight. That's still echoing through our minds as we've experienced it. PTSD, depression, anxiety, people losing family members, children dying from these illnesses, and not knowing if your family or you are safe. Real life-threatening stressors as we try to do our jobs. So how do we develop and continue to be resilient? Well, let's start with the first piece, meaning. Why are you doing this? What led you to become a public health care professional or involved in healthcare in your community, in whatever form it is? Think of your own origin story. For some people, it's, well, that was the first job that was available and I needed health insurance. Or my cousin knew somebody at the office. But then on the other end of the spectrum, you've got things like wanted to make a change or difference in the community. And sometimes we shift, right? We start off with one reason and we shift over to something deeper, something more meaningful. If we're not careful, it can go the other way. We become burned out, we lose touch with that. But I'd ask you to just consider, what's your origin story? How did you get involved? Now, what inspires you now? What keeps it meaningful? And you might be out of touch with that meaning right now. Is it your coworkers? Is it your clients? Is it that community that you're part of? Is it that you know you're involved with systemic change or individual change? Is it your value system that you're aligned with? Is there something spiritual that centers you here? If you're out of touch with the meaning of your work, it's going to be challenging to weather the stress in a resilient way. And many of us don't work in organizations that focus on the meaning of the work. They want to help you do the work. They want to train you, support you. But inspiration, we want to make sure that you are in touch with meaning. So if you're a leader, I really want to encourage you to design interventions, we call them, or programs to keep people in touch with the meaning of their work. Why are they doing it? Jason had the opportunity to help the tribal community for many years outside of his community. So doing that work outside, then you got to work inside the community. What an incredible opportunity for you. That must be so meaningful. Once we get out of touch with meaning, we're going through the motions. And that means we're vulnerable. Keep these coming. These are great. Advocates, truly connected to what the community needs. Now, if we were in a small group, and we do this at Workhaven, we try to get people in small groups, and in the old days in a room, these days in a Zoom, and we get these conversations going within an organization. And I encourage you to set these up in your organization, where you meet once a month and you talk about the impact of the work on people, not how to do the work well. You guys are already doing that. How is the work impacting you? Sharing with each other, connecting around the impact of the work, and then staying in touch with, well, then why are we doing it? Because if you're talking about why you're doing it, it's not just a meeting about how hard it is and how everyone's struggling and the way they are struggling. That's a good way to connect. But we add the piece of, okay, so why are we here? Let's leave this meeting back in touch with it. Let's get back in touch with it. If you can do that once a month, ideally once a week, once a month with your people, I think it can make a phenomenal difference. Staying positive, staying realistically optimistic, Tracy. I think that's a great attitude and is borne out by research as well. I'll mention that a little bit. So just asking you for a moment, small meditation here, 2 minutes, just asking you in the spirit of awareness to become aware of your own breathing. You may have some sound, some commotion going on around. See if you can just become aware. You may want to close your eyes. It can help with focus. Breathe and become aware of your body, how you're sitting in the chair, how you feel, tired versus energized, loose versus tight, heavy versus light, restless versus present, numb versus overwhelmed with feelings. Become aware of how you feel right now and lean into it. If you're trying to stay awake, I want you to lean into that fatigue. If you're excited about this information and this moment to connect, I want you to lean into that excitement. But I want you to try to become aware of how you feel and really allow those feelings to exist. I always encourage people to visualize making space within themselves for the feelings they have and connect to it. And there could be grief there. There could be anger there. We're people, we have all kinds of feelings. But whatever you're feeling right now, just allow it to be. And as you get in touch with those feelings, as you sit in your chair. Try to connect your physical feelings, your emotional feelings with something that is important to you and value. This is exciting to me because I want to do a great job. I want to help out my community. Or I'm tired because I stayed up taking care of the kids, and that's important to me. Or I'm frustrated because there's other work I want to be doing right now, and it's important to me. Whatever it is, without judgment, see if you can get in touch with a value and put that in the chat box. Let's hear some values people have. You can put one word that you can get in touch with right now as we just take this small amount of time and focus on resilience. What is important to you that connects with what we're talking about right now? It could be anything. I like one word values, but it could be anything. What I'm modeling for you right now is a way to stop in the middle of the workday and have a silent moment where you check in with yourself. You breathe, a moment of mindfulness. You get in touch with how you're feeling. And you get in touch with one value that you have, something important. Why am I doing this work? What's important to me? And if you do that once a day, people tend to find that they look forward to that moment. It's sort of like, if I can just get to noon, I'm gonna get to that little meditative space, and I'm gonna, in the case of Ginger, get in touch with connection. I value connection, because the final step of this exercise is, okay, now I'm going to get out of my chair. I'm going to do something to pursue connection. I'm going to go to the next office over, or I'm going to reach out to somebody. It's a way to recharge in the middle of the day and stay in touch with your values, the meaning of your work. You will be getting a PDF of this PowerPoint. You can go through and remind yourself. Gratefulness. Thank you, Jasmine. Getting in touch with this. Now, if we have more time, we could spend more meditative time around this, but I just want to give you the exercise here as we move into. I'm going to go through this a little bit quickly because I think we all know this. The challenges that we've all been through, the surge in demand for healthcare, public and medicinal healthcare, the risks of infection, the equipment challenges, providing support, psychological distress and outbreak. These, by the way, are all published in articles in the medical journals talking about how anxious everyone in healthcare is. Anxious about exposure, anxious about testing. Is my organization going to be able to take care of me if I get sick? What about childcare? What about my family if I'm working more? So many different stressors. What if I get deployed somewhere? How am I going to stay up to date? So these are all the stressors we're dealing with. And people feel disconnected completely at first. Then they were virtually connected like we are now. And now they're talking about reconnecting. And what does that look like? Reintegration, the hybrid workplace. Issues like child care, elder care, financial losses, disconnection that happened, health burdens, people with long COVID, and all that disconnection from everything from your friends, family, all the way up to communities, even disconnected from yourself as we sit alone at these computers and become disconnected. How are we going to stay resilient when we're dealing with all of this? Well, healthcare workers have suffered from depression, higher levels of insomnia and distress. So if you've been struggling, you are not alone at all. The data is very clear, and this continues. We've got the perfect storm of stress, uncertainty about the future, and a lack of control of what's going to happen with COVID. we as people, this is sort of a perfect storm of stress for us. So I think we've made the case that it's a difficult time, even now, although things seem to be improving in some ways, for sure. The good news is that even though trauma, which is of course an extreme form of stress, is quite common, 62% of US adults have experienced some form of significant childhood adversity or trauma event. In fact, 25% of people have 3 or more. There are lifelong mental and physical health burdens from trauma, but most people don't meet the criteria for a mental health disorder. Though when they do, it's distressing and impairing and we need help. Most people don't get that level of distress. That's great news. What does that mean? It means you are strong. It means you are resilient. So our natural state is to be strong and resilient. We just need to learn how to cultivate and continue that natural resilience that we have, because we all go through a lot. One of the things that we can do is normalize your emotional reactions to the stress that we experience in the workplace. People should be able to talk about anxiety, everything from denying COVID is a problem to hysteria that it's worse than it is. Of course, there's going to be fear and panic, sadness and loss, grief, powerlessness. All these are normal emotional reactions to what we've been going through. Anger, numbness, hopelessness and guilt, even shame, I'm not able to do enough. Moral injury for some people, meaning I'm not able to help people enough in my job and I feel a sense of violating my own values. A huge range of emotional reactions to stress. And it impacts everyone differently. Our physical lives, difficulty concentrating, sleeping, eating, activity levels, feeling like I can't control my thoughts, having nightmares, physical reactions, chronic health problems are exacerbated. We get pains and aches and physical reactions. There's kind of a rogues gallery here of how we're impacted, and we should allow ourselves to experience these things, in other words, not deny it, and communicate to each other about it in the workplace, normalizing, hey, we're undergoing a lot here, including anger and having short temper. Many people will increase their attempts to escape these feelings. Alcohol, tobacco, other drugs. Some people it's workaholism, a variety of ways to get away. So again, how has COVID-19 affected you? Gender, talking about something that millions of people are feeling. I mean, just, it's such a human experience. Feeling guilt about not going back to the bedside and working in the ICU or the ER again. Can it ever be enough, in the midst of a pandemic? We are helpers. And so I hope that this section has allowed you to accept that you can be impacted by this. There's no shame in it. It is part of being a person, and it's certainly part of being a helper. We want to make space for that in the workplace. You can talk about it. Maybe we check in with each other, but it does beg the question, what do we need to feel more resilient? What's the path? Healthcare professionals in a recent study want to be heard. This is a great list if you're a leader to have on your desk. They want to be heard. They want to have a voice with leadership. They want to feel protected. Someone's looking out for them. They want to be prepared. They want to be told ahead of time about change. They want to be updated. They want to be supported. They want to be offered support, whether it be emotional support and encouragement, but also support in the equipment that they're given and told, what do you need? They want to be cared for. And this is a shift in the workplace. People being told that they're genuinely cared about. And then finally, they want to be honored. And this is something that's really changed, I think, in the healthcare workplace these days. Having honor ceremonies where people are awarded and recognized for the work that they do. On a Friday afternoon, recognizing in a meeting or having a specific meeting around honoring what we've all been through and the resilience we've shown. We encourage people to formalize that. So let's talk about coping. What are you doing now to cope with the ongoing stressors that are happening? How are you navigating these waters? If you had, if we were in the same room together, I would say get out a pen and write out 3 ways that you're doing to actively cope to maintain your resilience, your functioning. What do you do intentionally? Commonly, people go to exercise. They go to a spiritual practice. They go to social connection. I'm going to give you a nice list that you can have when we pass this out or email this to you, a detailed list of things you can do. But resilience is intentional. It's a way of life. And it starts with framing. Framing is, as you know, how you think about things. We want you to intentionally decide to frame your adversity on your own terms. All right, how am I going to think about this? What's the problem? Well, in this case, COVID-19 has been a more than 2-year full-on healthcare crisis. In 10 years, how do I want to look back and recall how I coped with it? Not did I stop it? Not what was my work performance? Not how much time did I spend in the ICU or the ER, or how many patients was I able to get back off the ventilators, or how is my community doing? I'm talking about how you handled yourself, how you took care of yourself. How did you maintain your resilience? And that starts with framing. And what we run into with healthcare providers is they forget that taking care of themselves has to come first. They're just often not wired that way. That's what I'm talking about. Framing the pandemic as a challenge towards self-care and resilience and looking at it that way. It starts with that. Getting up in the morning and intentionally saying, okay, how am I taking care of myself today? Well, I've got the kids. Well, I've got my parents. Well, I've got other family. Well, I've got the community. Certainly have my staff and the team. And yes, but let's start with you. How do we do it? Well, we focus on resilience as a process. There's not a lot of research on it. But basically, what we want to do is we want to build on the strengths that you have and the resources that you have. And I'll go into more detail. It's getting into good habits. That's the bottom line. It's developing a day-to-day healthy practice of living. That's much more powerful than whatever you're going to encounter at work tomorrow. Whether it be a disastrous team dynamic, or a client who passes away, or a community that's struggling. The research shows that if you develop healthy habits, that's just as powerful, or sometimes even more powerful, than the adversity that you face in terms of your mental health and function. That's not to say we're going to ignore the oppression, the pandemic stressors, the terrible things that we read in the news. We're not going to pretend those don't impact us. But we're going to acknowledge that if I can get some really good habits going, or continue and tap into what I've already got, I think I can really stay resilient and have a chance to thrive as much as possible. Part of that means making meaning out of the work I do. I wasn't in the hospital all the time, working directly with patients. I've got to make sense out of that. Well, I can't do everything. I can't sacrifice myself or I cease to be helping. So making sense of adversity and stress and connecting it to something that's important to you is very important. Meditating on why you do the work. Can't say that enough. And I really think it's not the norm in the workplace. And we're going to talk about how to stay resilient through self-care, which really means self-regulation. Maintaining, the fancy language in psychology is called sustaining goal-driven behavior, but it really means, how do I do my job and stay functional? Well, we want to stay in touch with what's important to us and maintain these healthy routines. Stay connected with others. What are your assets? What are your strengths? If you haven't been to beacharacter.org, I encourage you to go after this talk. You know, most of the questionnaires we fill out are all about what's the problem, you know, especially psychological inventories and questionnaires or workplace questionnaires. This is a website you can go to and it will assess your strengths. It will tell you what your strengths are. And it's really great. It's great to read about your own strengths. And I really encourage you to do it. If you're a leader, try it. And it's free and it's empirically validated, psychometrically sound, we would say. It's all about character. What are your strengths? You ought to know them and you ought to talk about them and you ought to rely on them, the psychology research suggests. So we're not talking about developing new personality here. We're talking about finding out what your strengths are, really knowing what they are and leaning on them. And then what are your resources? Resources are material. I'm lucky to have a roof over my head. I'm lucky to have a job. They're also social. I'm lucky to have family and friends. They're professional. I have a network. What are your resources? You have internal assets, you have external resources. I would advise you to make a list of your external resources. And I would advise you to go to beacharacter.org if you don't already have a good sense of your own strengths, your internal resources. And consider writing about it. Consider writing daily. James Pennebaker is a well-known psychological researcher who said writing 2 to 5 minutes a day, we're talking about half a page, actually improve mental health. If you don't have a work journal, I would recommend it. Most people don't, but it's a way for you to talk about your assets and your resources, or maybe you just bring it up in a meeting with your team. What is this team's strengths? What are this team's resources? What are our community strengths and resources? And what are mine? And then further design activities that express them. You know, well, I'm really good at building teams. So today I'm gonna design a team building exercise. I'm really good at client interaction. So maybe I'll make up a list of tips for client interacting. Or I'm really in touch with my spirituality. Maybe I could really focus, get that into my calendar and really live out my assets and my resources. This is about discovering what your strengths, your resources are and leaning on them intentionally. Now, here's my list that if I gave you a quiz as healthcare providers, as public healthcare officials, you'll ace it. These are all the ways that you stay resilient. This is all empirically validated. And I'm going to include actually a really nice handout, full color by Vibrant Mental Health, which is a nonprofit I work with sometimes, on self-care activities. So if you want a menu of resilient self-care activities, we've got it for you. But you already know it. When we do some research on folks and we ask professionals like yourselves, how do you take care of yourselves? They know. It's just being intentional. First, don't forget to breathe. When in doubt, breathe and meet your basic needs: sleep, hydration, eating 3 basic meals and having snacks twice a day, not eating late, taking breaks from work and setting boundaries with work. We all know about the phone and the email and the texts. Create routines. There's tremendous psychological research on routines. They're very powerful. We are meant to live in a life of routine. 10,000 years ago, people were living quite routinely, living through seasons, living through incredible routines. And of course, we know the narratives from that time bear that out. We need routines, we need schedules, we need regular social contact, and we need pleasant distractions on a regular basis. All of this is drifted away as the boundaries between work and life went away with the pandemic. You're sitting in your living room. I'm in my kitchen right now doing a presentation, as I often am. The boundaries are blurred, and we're, like many of you, I'm probably going back to the office soon, and it will be a reestablishment, probably a jarring reestablishment of another boundary. We've got to intentionally connect with our colleagues as we re-engage, and we've got to communicate constructively with feedback sandwiches. Good news, then a criticism, then more good news. We've got to remember how to communicate constructively with each other, stay in touch with people we care about, respect differences, and stay updated on what's going on in the world, but not too much. Limit media exposure. And we've got to make sure that we check in with ourselves. Sorry, I'm just moving my chat around so I can see. Now, I know I'm just rushing through this, and you'll have this in your handout, but you can see how many options there are to live an intentional life of caring for yourself, including honoring your own service. How do you do that? Each week, is there something you do to honor yourself and your service? And I'm not talking about self-absorbed narcissism. I'm talking about honoring the fact that you spent hours and hours of your week serving others. And of course, one of the greatest ways you can honor yourself is to seek help when needed. I'm a psychotherapist. Psychotherapy, I compare to vitamins, or on the other end of the spectrum, to a spiritual experience. There's a way for us to connect with ourselves and something greater. And when we have a mental health crisis, that's off, and therapy can get you back in touch with yourself and your community. Therapy is a very healthy experience that we want to destigmatize. And so if you need some help, seek it with your friends or a spiritual advisor. And if you feel like you have a mental health issue like depression, anxiety, it's just not shifting with your normal assets and resources, reach out. That's what mental health care providers are for. And of course, we want you to be doing meaningful things throughout the day. Okay, I know I'm rushing through this, but this will be on your list, and you can, and I'm going to give you something that actually has boxes to check off. It's very useful. But in the bigger picture, we want to wean you off social media and news as much as possible. I apologize to Facebook, but it's a lot of research that says social media isn't that healthy for us. Neither is too much media. There's a sense of powerlessness with the media. There's a sense of comparison with social media. It's not particularly healthy for us. We're all struggling in our different ways. And if we look at this curated life that people present on social media, we might make a comparison that's not really fair. So we want to refrain from judging ourselves. We're going to have shame and guilt. They're normal parts of being a person. And the best way to deal with shame and guilt is to talk to people about your feelings, people that you trust. And we're talking about workplace resilience, but shame and guilt get into the workplace. So there are times when it's wise to talk at work about how you feel. And then there are times when you may feel more comfortable with a spiritual advisor or a family member, but communication is going to be key. One day at a time. So these are sort of this last slides and this slide I present as sort of a research-based set of instructions for living a resilient life. If you can practice whatever works for you, you're going to have a better chance of maintaining your functioning through stress and thriving. But at the bottom of it, this is actually a phone booth in New York City. You can see the Empire State Building behind it. When I is replaced with we, even illness becomes wellness. We have to stay connected. So as we come near the end here, I would ask you right now to identify 2 ways to cope with navigating the uncertainty the rapid change that the pandemic has brought to us. Start small, choose something that you think might work best for you, focus on something you can actually change, and actively manage your stress rather than reacting, waiting. Maybe you can enter into the chat box. One of the ways, I'm going to go back to our list here. Here's a list, for example, the list I had before. What are some ways that you can add 1 or 2 intentional self-care interventions into your life? Is it just making sure you breathe during the day? Do you need to limit your media? Go ahead and make yourself a list of 2 items, 2 things you can do this week to work on your resilience. And if it's with your team, to talk about during your team meetings. And if it's with your organization, maybe you espouse it in your organization, all the way up to the community level. And then I also would want you to identify 2 people you can connect with in the next week. Who can you reach out to this week and talk about, I went to a talk on resilience, and this guy keeps going on and on about how important human connection is. And I realized I need to reach out more to people and let them know how I'm doing and check in with how they're doing. Not how effective they are at work, but how they're feeling. And making that connection and making it a regular connection. It could be a regular work impact meeting. We call them resilience groups, where you meet once a month. Could be a friend. Let's check in once a week, just to check in. So I want you to leave with 2 coping mechanisms today and 2 people you can connect with today. And this is our list. There are a lot of resources out there, including the disaster distress helpline, which definitely applies to the pandemic. The numbers there. There are a variety of, and these will all be linked on your handout, sources of information and helplines. The suicide hotline will soon be, I believe, 988. It is 911 right now, but I believe we're switching it to 988. We want everybody to have all those resources they can have. Now, what I usually do at this point is open up to questions, because I've really just skimmed the surface here. I've also talked a lot, so it's difficult, I know, for everybody to really track. I love this from Jasmine: self-compassion is necessary. Any questions that you want to ask, or subjects that you want to make sure that I touch on, like team building or leadership, or specific issues that you see, please let me know. I'm happy to talk about it now, or I'm just going to put my, I'm going to put my email address in here again, so you have it. I'm happy to talk to people about specific issues in the workplace, or their specific efforts to be resilient. And I realize it's a long talk, so please let me know later if your attention span is depleted at this point. Any questions or thoughts anybody wants to share? Okay. Well, listen, thank you so much for your attention. I know it's always challenging to go through these things. I really appreciate everybody and all the work you're doing. And again, sometimes it's easier to email. I have ongoing conversations with people in different work situations, and I'm happy to do that with anyone who's interested. So thank you for the time. And you guys let me know what I should do next. Stop the share, for example. Okay.
Thank you, Mark. Okay, Pamela, if you'd like to close. Thank you, everyone. You're on mute.
One of these days, I'm gonna have to say, oh, I'm on mute, I'm just talking away. But anyway, on behalf of USET, we'd like to extend special thanks to you all for participating. And thank you, Mark, very much for presenting today. It's my understanding that the evaluation is in the chat. And we are asking everybody to please, 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 please participate in completion of the evaluation. If you have suggestions of additional things that you would like, topics that you would like to have addressed, please feel free to do that. Does anyone have any questions or anything at this point? Anything else you want to say or address? All right, again, please go to the chat. And please, 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 please put your comments in there because we like to have your feedback. We really do appreciate that. So again, thank you all very much for participating, and we look forward to seeing you again in the very near future. Bye-bye.